Greetings YouTube, G-Doc here. Being a doctor, especially in primary care, you see a whole range of problems and different kind of patients. Some are interesting, some less so, and some are just plain annoying to deal with. But what are some of the really common, most troublesome patients to deal with in primary care? Does your doctor fake his niceness? Or is that just me? Let's take a closer look at two of the most common, annoying groups of patients we see in primary care. Number 1. Lower back pain. Doctor, my back hurts. You have to do something. The doctor replies something diplomatically, along the lines of, "Oh, I'm so sorry to hear that. We'll get you better." But on the inside, he's actually crying to himself, because everyone gets this. Like 60 to 70% of people at least experience considerable back pain during their lives at some point. And with back pain, I mean the most common kind, the lower back pain without any nerve impingement, which means mostly muscular, the usual type. This kind of patient just sucks. For several reasons. They are in legitimate pain, and you want to fix it. Everyone gets it, and it's like the most common cause to seek a doctor, out of all causes. There's not really much to do about it. In fact, there's pretty much no scientifically proven treatment for it to go away. Despite that the doctor might stuff you full of drugs, send you to physical therapy, give you exercises, even set injections. But none of these things are proven to work, and it usually goes away on its own. Usually within about 3 months. But it does come back quite a lot too, and so the patient is upset with you not being able to cure them. On top of all this, back pain is a complicated, simple problem, because many things tend to affect the outcome. Less resourceful, less motivated, and more psychologically troubled patients tend to be more prone to getting back pain in the first place, and also not getting rid of it, which makes dealing with it all the more difficult for everyone involved. So what do I usually do? Well, I'm a firm believer in placebo, so if I'm acting all excited and "ooh, you're gonna be fine with this," I'm probably being a good doctor. My national guidelines on this topic says though, that nothing really works in curing the condition. But no patient is gonna be happy with that. So I usually prescribe some ibuprofen and tell them that this should be as active as possible, at least after the first 1 to 3 days. Imagine though if your doctor is like, "So yeah, try this, but I don't think it's gonna make much of a difference though." That's probably not gonna do much. Number 2. The common cold. So the reason why this can be pretty annoying for the doctor and the patient is even in its name. It's common, like so common that it's more uncommon not to get it. Children can have up to 10 episodes per year of this viral infection, and adults usually have around 1 to 2. But you know, some adults act like children. The symptoms usually consist of varying degrees of nose stuffiness, low-grade fever, mild fatigue, and some cough. The symptoms usually start to go away after a week. Usually, meaning that it could last longer or shorter, and start to go away, meaning that it usually begins going away at that time, not that it's gone after 1 week. This means that I'll have people coming in during their 2nd or 3rd week of their cold asking for antibiotics. I then usually proceed to tell them that if I had a cure for the common cold, I'd not be sitting here treating their butts. I'd be sprawled out on some beach somewhere. This kind of patient is annoying because viral diseases like the cold and also influenza aren't really treatable the way bacterial infections are with antibiotics. Despite this, people expect that the doctor does something, and some just straight up demand antibiotics despite me telling them that would have no effect. They'll then sometimes proceed telling me another doctor prescribed antibiotics the last time they had a cold, which makes me seem like the bad doctor for not doing the same, which is pretty ironic. This is a reason why antibiotic resistance is a big problem. It also differs by culture a lot. Just look at this map of MRSA prevalence, a type of bacteria resistant to all kinds of penicillin. Nice one. So yeah, cold commoners, you can all thank yourselves for that. But anyway, feel free to book a new appointment at any time. I'll be here. Thank you for watching my video. If you enjoyed it, please give it a like and subscribe for more content on medicine and science.